Hello and good afternoon. We are live on Facebook, LinkedIn, and YouTube. It's great to be coming to you again. My name is Joe Woolley. I'm the CEO of the Nashville LGBT Chamber of Commerce. And if it's a Thursday, we're having a program. This Thursday, we are back with our Member Connect program, one of my favorite things that we do, where we talk with our members about their business and what they have going on. These are always great, and we're doing more and more of them. They're not just the second Thursday of the month. We're doing them all the time now, but this is our scheduled one, and it's great to be with you today. We are talking to two of our wonderful members today, Music City PrEP Clinic and Nashville CARES, both doing incredible work. If you want to be part of the conversation, wherever you're watching us, if that's Facebook, YouTube, or LinkedIn, put your questions in the comments section and we will ask those to our presenters. You can put in comments anytime. We're going to have a Q&A section with both of them at the end of their presentations. We'll highlight you and your question on the screen when we do this. This program is part of the Rainbow Connection series. This series includes networking events, educational opportunities, and connections all around. Check out our website for more information on upcoming events. The other programs that we have on our Thursday programming days are Network Connect. That's our brewing up business that we've been doing for 23 years now. We have a big anniversary coming up this weekend, our 23rd anniversary birthday. We've got Classroom Connect, which is our educational program sponsored by HCA TriStar Health, and Corporate Connect, which is our program for our corporations to get together and talk with each other on the work they're doing around diversity and inclusion and LGBT workplace policy. Benefit Connect is a new program that our membership manager, Lauren Bland, brings you the first Monday of every month, talking to you about all the different membership benefits you get here at the Chamber. And you can find all of those on our website. We'd love to have you join us for any of our events. It's great to have you here with Member Connect, so let's get started. Our first member we are talking to is Music City PrEP Clinic. And Music City PrEP Clinic was our first titanium level member. And they joined just over a year ago. At that level, we were very thrilled to have them come in and join at that level and support our work. We had been working with them before that as they got up and running here in Nashville. They have been going since 2017. And speaking today for them is their executive director, Richard McKinnon, but he goes by Rich, and that's how I know him. And I'm sure I'm going to call him Rich the whole time today. But Rich McKinnon is co-founder of Music City PrEP Clinic. The clinic was founded in 2017. He founded it with Rod Bragg, Joe Taylor, and Stephen Davidson. After Rod Bragg's untimely passing shortly after the clinic's founding, Rich McKinnon took over the role as executive director. In less than 2 years, Rich McKinnon grew the clinic from a small startup with a handful of patients to the largest provider of PrEP in the state of Tennessee. Rich, it's great to have you here today. Welcome.
Thanks for having me, Joe.
It's great to be with you today. Tell us a little bit more about Music City PrEP. Actually, what I think we should do is start off with what PrEP is and then what Music City PrEP Clinic does. Can you inform us on that?
Sure. So PrEP is an acronym for pre-exposure prophylaxis. A condom is a prophylaxis, but you can also have a pill that is also a prophylaxis. The purpose of PrEP is to prevent HIV, and it does a great job of that. In fact, it's more effective than condoms because people don't always have condoms on them. They don't use the condoms properly, or they don't want to use condoms. But if you have the pill dissolved in your bloodstream, then you have that protection. And so our mission is to end HIV in Nashville and Middle Tennessee. We're doing this as essentially an STD clinic. So we screen and treat for all STIs And in the process of doing that, we remind our patients that if you are sexually active and concerned about STIs, that's why you've come into our house. You should also be concerned about HIV because you can get it in similar ways.
All right, so tell me a little bit more about the service of Music City PrEP. So I think that's wonderful to know. It's amazing the work that I do when we talk about PrEP. There is still a lack of knowledge out there, I think, by a lot of LGBT people, but also straight people as well, that you can take a pill and it prevents you, it does a large part in preventing you from getting HIV. That still out there is not widely known. I think even the medical community is not fully aware of it. I think it's caught up over the last 3 or 4 years. But anything there that you want to talk more about around PrEP itself, the education around it?
Well, when we got started, there wasn't a lot of information about PrEP in the general community, and there were many providers that weren't familiar with it. We've had what we call refugees from different providers because of the lack of information we had one couple join us because their primary care provider, who they loved and enjoyed in every other aspect of medicine, but when they asked that provider about PrEP, the provider said, "Isn't that a drug for sex workers?" Well, of course, that couple immediately felt insulted. We're not sex workers, and we're not trying to judge sex workers in this conversation, but the way that was brought up by the provider was judgmental, and so they no longer felt comfortable with talking to the provider about PrEP, and so they came to us. And one of the things that we try to reinforce in our staff is to remind them that not only with PrEP, but when it comes to all kinds of conversations about sexual activity, sexual behavior, particularly within the LGBT community, just because you're a physician doesn't mean you're automatically comfortable with these topics. Some physicians prefer different areas of medicine over other areas of medicine. And maybe talking to the LGBT community about the medicine that applies most to us is not their sweet spot. And so they can stumble there and unnecessarily introduce some stigma in a conversation. So we are trying to be the go-to place for people that are interested in sexual health and wellness.
So and that is what is in the mission. The clinic is a sexual health and wellness clinic. Our mission is to get to 0 new HIV transmissions in Nashville and Middle Tennessee. We work towards this by providing free PrEP and PEP prescriptions, regardless of income or insurance status. So first question there, PrEP, you talked about that at the beginning, and then PEP, in your mission statement is the term PEP.
Yep.
You said what PrEP was. What is PEP?
Yep, it's another acronym. So PrEP is pre-exposure and PEP is post-exposure. So generally, people use PEP after they feel they've already been exposed to HIV. And this can happen, with healthcare workers with a accidental needle stick, or maybe an encounter gone wrong for other people, like a date that didn't go the right way. So there is this medication called PEP. We will provide that treatment for you, and then recommend that you transition over to PrEP as opposed to PEP.
Good to know. That is very helpful as we continue to educate around this. So the next part of that was you get those prescriptions regardless of income or insurance status. How does that work, and why is that so important in the work of Music City PrEP?
Well, one of the things that kind of is a barrier to care is that the PrEP medication is expensive. If you try to buy it retail without insurance, it can be $1,800 to $2,000 a month. That doesn't include the labs that are necessary, plus any office visit copays, etc. we feel that one of the important ways of reducing the barrier to care is to make it all free, regardless of your insurance status. So people with insurance, even if they go to a primary care physician that they enjoy seeing and they get their PrEP prescription from them, chances are they still have a copay for that office visit. They may need to meet deductibles to cover those labs, and there are labs needed every 3 months. And there may be a copay for the medication. And these are people with good insurance. All right. Those people, if they come to us, they don't pay anything. So not only is it less expensive for them, it is LGBTQ sensitive care, and there's the extra benefit. Because we are a nonprofit, any of the proceeds that we get from those insurance benefits, we redistribute to our patients who are underinsured or uninsured. So the patients with great insurance are helping themselves by reducing their out-of-pocket fees. They're getting a better healthcare experience, and they're helping their community by participating in our little Robin Hood scheme, where we're redistributing the wealth, so to speak, of their insurance benefits, which otherwise would have gone to private stakeholder pockets.
Do you see a lot of your clients that have insurance that maybe started with PrEP and have moved over, or are the majority of clients ones without insurance or healthcare coverage?
Most of our patients today have insurance, some form of insurance, and that's important that we maintain that payer mix so that we can continue to provide care to people who are underinsured or uninsured.
The other part of that mission statement, after what we've just talked about, is our services include discrete, no-cost lab testing for HIV and bacterial STDs, plus hepatitis A, B, and C testing. So there are additional components of that. You mentioned it in your comments earlier about the 3-month check-in and process. Can you walk through, for those that might not know, what does a patient experience? So they have found out about PrEP, they come in and see you, you consult with them, and they start taking the medication. What does that then look like?
Well, it begins actually with talking to one of our navigators, also known as liaisons or patient advocates. And the reason why we invest so heavily in navigation is because we think that the type of healthcare we're providing is different from the type of healthcare you may receive at other places. We're very hands-on and relationship oriented. And this means that we have to help educate the patient. We have to help them feel comfortable with the costs of it that they don't have to pay, but there still is some insurance issues that need to be worked out for some of them. And for the people who are uninsured, then there are some applications that we have to fill out on their behalf so that they qualify for payment assistance. So there's a lot of paperwork for some of our patients, and there may be some anxieties that this could be too good to be true, for example, right? That they could end up with a surprise bill, or anxieties that maybe there are really serious side effects that we're not being upfront with. And so we have to address all of these concerns to their satisfaction so they understand that this is a safe way to manage their sexual health and wellness. And then that relationship leads them to the medical provision, which actually is a very small component. If you think about it, when you go to any doctor's office, you deal with so many staff members before you actually get to the doctor themselves, right? And that's the same thing with us. So our navigators really are the carrying the heavy load of helping people understand the process. And this is right up until you see the provider, and then afterwards, because it's important to us, if we're going to end HIV, that we just don't send you a prescription and then drop you off, right? We stay in touch with you all throughout the period leading up to your 3-month follow-up to make sure you're still taking the medication, to make sure you're not having any serious side effects, to answer your questions, because we can't end the epidemic if people aren't taking the pills. It's important.
So taking the pills is very important. You take it daily, correct?
Correct.
And it's very important that you take it at the same time and it stays in your bloodstream at a certain level to make it effective. So you're working with them at that. What is this 3-month checkup that you come in for? Why do you need to come in at that 3-month period?
Well, that is a CDC guideline, the PrEP protocol, so to speak, that we check in with all the patients quarterly. Primarily, it's for in an overabundance of caution that the medication is not causing any um, damage to your internal organs. And there really has been no scientific evidence in non-HIV positive patients that this is a concern. When PrEP was part of an HIV regimen, so for people that were HIV positive and they were on a treatment regimen, some of the medications that are in PrEP were part of that regimen. And in some of those patients, they did see some damage, right? In some of those patients. In the HIV positive patients that were using these medications as part of HIV positive care. Okay.
All right. Damage to what? It's your liver, correct?
Liver and kidneys are the things that they're looking at. Okay. And so, you know, one of the great benefits of the research into HIV care is that PrEP came out of that. So some of the medications that were helping HIV positive patients are now helping people who are not HIV positive. But because there is this information in its past that it could have an effect on liver and kidneys out of an overabundance of caution, we're monitoring that. But it's very rare. And in fact, when these quarterly blood tests look at any possibility that something might be wrong, it's been shown that if you stop taking the medication, the tests return back to normal pretty quickly.
So you're coming in to get your quarterly blood test to look at if you're having any adverse reaction in your kidney or liver. But at that 3-month appointment, you're also doing additional things, correct?
Sure. Yes, we're doing tri-site testing for STIs, and that means it's a throat swab, rectal swab, urine collection, and blood test. And, you know, a lot of primary care providers, when they're doing an STI screen, it's basically urinating in a cup. But unfortunately, they miss about 2/3 of all STIs, the ones that aren't detected in just the urine. So by catching the STIs with the oral and rectal swabs, we are one of the few organizations that's regularly doing tri-site testing as a matter of protocol for every patient that comes in for an STI screen. As a result, we are not only increasing the number of people that are being screened, we are also increasing the number of STIs that are being reported to local government. Okay. And this is not because people are necessarily having more sex, it's just that the number of the amount of STI prevalence in our community had been previously underreported. So more testing, more information, better treatment. Sounds familiar.
You are, yes. So you're also screening for gonorrhea, syphilis, HIV, chlamydia.
Yeah.
And so, yes, let's take it there around the advocacy piece of this, because when I got involved around PrEP 4 years ago, well, 5 years ago now, 2016, when it was first very new, there was a lot of misinformation out there, or the information at the time was PrEP was going to cause more promiscuity. It was going to cause people to have unsafe sex practices, and it was going to make the STI infection rates shoot up. And they point to that data that's saying like, oh, look at all these STI infection rates. What you were just saying, I think, is very important, that those rates were probably always there. They just weren't being caught, like identified, and the spread was continuing. The interesting thing about PrEP with the 3-month check-in is that you are able to catch STIs in a 3-month window and then treat those The important thing is for patients, and I know you guys have worked on handling this yourself, because you need to treat right away, because what you've seen in younger people that take it is if they test positive and then have to go seek treatment elsewhere, that can be an issue. You want to get them treated right away, and then you also want to be able to do contact tracing to make sure that they're contacting their sexual partners, so that those people can get treated right away too, and it stops the spread. Similar to what we've been going through for a year with COVID. And
yeah, it sounds familiar. Yeah.
Yeah.
So, a lot of people don't realize they have an STI because the majority of the STIs out there in the community are asymptomatic. You just don't know, and you could have had it for months, and you're innocently, inadvertently sharing it with all your friends that you're having sexual relations with. So that's why the level of prevalence was probably underreported in Nashville. So what we're doing is while the numbers are going up because the testing is going up, we expect the numbers to start to drop as the treatment also goes up.
And I referenced this just briefly, but part of that treatment of the STI, once you are positive, is being able to then treat for it. And Music City PrEP was referring patients to their primary care physician or other outlets to seek that treatment. But you guys have been working on that, and I think you have an announcement to.
Yeah, we do on-site treatment for STIs now, and that really just improves the patient experience, and also helps us, participate in the public health management of the level of STIs we have in the community, and also just the sheer number of patients that we're getting. I mean, we're growing so quickly, so it's just more screening and more treatment, and I feel that this is the way to go. And again, this sounds all very, very familiar, but in our first bona fide year of existence would be like 2019. We were trying to go from 100 to 1,000 patients. Then in 2020, we were trying to go from 1,000 to 2,000, and we actually went to 4,000 in 2020. And in the first quarter of 2021, we've gone from 4,000 to 5,000 patients as of just a few days ago.
Wow.
So I mean, the number of patients that are coming to us for this service is really it's amazing news for our community, because I think this is the way we're going to not only normalize STI conversations about sex, conversations about STIs. It is the main way, I believe, that we're going to reduce the stigma around HIV and HIV care and HIV prevention, and that's how we're going to get to our mission of ending HIV in Nashville.
That is a great segue into introducing a new staff member over at Music City PrEP. Stephen Uguwe is your new Director of Community Relations. Stephen, so nice to meet you. It's great to have you on. I wanted to bring you into this part of the conversation to talk about who are you serving? I think we started off talking about gay, bisexual men being the target audience. Now, PrEP is not just for them. What communities, who is getting PrEP? Rich or Stephen, who is contributing to the numbers of growth, the growth numbers that you just referenced?
Stephen, do you want to take that?
Well, I can tell you, we started off and the growth has been largely in the majority community. But Mr. McKinnon has put together a plan, just as he's put together the remarkable plan that's led to the success of Music City PrEP. He's also put together a plan to increase footprint in our clinic from the African American community, from the Hispanic community, and we, constantly are working to increase that population and address the issues of how we bring down the number of HIV cases, and not just the majority, how we are able to do that for all communities across the board. So I am really, really happy to be a part of the team. I'm looking forward to the initiatives that we are working right now to pull together that will really make an impact in all communities in Nashville and in the state of Tennessee, and not just in the majority community. So I think the work that we're doing right now is going to be pay very high dividends for all communities. So I'm really, really happy to be a part of the team.
Good. Well, it's great to have you. Great to meet you. Let us know if the Chamber can help in any way in your work.
Thank you.
We have a question from P Flag Franklin. They ask, are you getting positive feedback from other healthcare providers in the area? For example, are you getting requests for education or referrals from other healthcare providers?
The answer is yes. And we've created a program where providers can refer to us, and we provide them with information education so that there is a handoff for them for their patients to come in see us.
Very good. If you have questions out there, you're joining us live right now and you have a question, please go ahead and put those in the comments and we'll make sure to ask that. You guys, there's a couple more points. We've got a few more minutes and a couple things that I wanted to bring up that I know about. You're very involved in the community. You sponsored the dance tent at Pride 2019. We didn't have Pride in 2020 due to COVID, but in 2019 you sponsored a dance tent, and then winds came and blew that tent down and threw it across the park the night before the festival. But you did sponsor that. You are sponsoring Franklin Pride. You're also very involved in the community in other areas. And then to kind of tie together the dance tent being blown away, Rich, I'd love for you to share how your team responded after the tornado, because the 2020 tornado ripped across the city, across East Nashville, and hit Music City PrEP offices. And you guys have quite the story there to share on how you continue to provide PrEP services.
Well, thanks to our very nimble team, we only lost 4 hours of service during all of that. We lost the morning shift because the tornado happened overnight, but we pulled the afternoon shift together over at Tribe, and they were great hosts for us. And so we held the afternoon clinic over at Tribe, and we did that for a few days until the city locked us down, and then we immediately shifted over to telemedicine, and that actually kind of worked to our advantage in a way, because telehealth is part of our strategic plan for growing outside of Nashville and Middle Tennessee, and it just put us on a faster track to getting there. And so I'm very proud of the team for again switching from our normal offices to Tribe, and then from Tribe to telemedicine. It's truly an exceptional team. One of the things I wanted to mention, though, is our partner strengthening grants, because our team can't end HIV by itself. And we do look to our community partners and maybe partners outside of the community to help us accomplish our mission. And so we have a program called a Partner Strengthening Grant Program, and Stephen administers this program. In our fiscal year that started June 1st of 2020, we committed to awarding $500,000 in grant funding, and we actually exceeded that by doing about $700,000 before the end of 2020. So we're not. In other words, we allocated $500,000. We gave away about $700,000. We're kind of on hiatus until the next fiscal year, unless something comes up. But one of the things we did was one of our partners, Streetworks, lost their building to the tornado, and so we allocated a few $100,000 from this money to help them buy a brand new building over on Rosa L. Parks.
That's awesome. That is wonderful. We are unfortunately out of time, and we have to say goodbye and wrap the program up to move on to our next member. But we sure do appreciate Music City Prep, the work that you're doing around this very important topic, your membership with the Chamber and the LGBT community, support of that community. Thank you so much for joining us, and I look forward to continuing to work together, and Stephen to start working even more with you in your new role. So thank you guys so much.
Thank you.
All right, folks, wonderful work going on there. Also wonderful work going on with our next incredible member. Let's see, Nashville CARES. Near and dear to so many hearts, Nashville CARES was founded in 1985. Nashville CARES is the premier HIV/AIDS service organization in Tennessee. Annually, they serve more than 50,000 people statewide and provide comprehensive services to clients through 17 counties in Middle Tennessee. They provide targeted education, free and confidential HIV, and broad range of comprehensive services to individuals who are at risk for or living with HIV. Their mission is to end HIV/AIDS epidemic in Middle Tennessee, and they work to achieve this through education, advocacy, and support for those at risk for or living with HIV. Their leader, Amna Osman, has 22 years of experience. There she is. How are you? Good to see you. Amna has over 22 years of experience as a public health innovator and executive leader with an extensive background in all aspects of leadership and management. Amna, how long have you been, I was trying to think, prepping for this interview, how long have you been in the position? It seems like yesterday you were coming in and taking over for Joe Inarane, who had been in the position for a long time and is a national institution. But it's been 5 years.
No, it's been 2 years. Actually, tomorrow will be 2 years. So yeah, I couldn't believe it yesterday. I was like, wow, it's been 2 years and so much has happened. Amazing work, and difficult year last year, but it's just been really great to be in this community and supporting people living with HIV and those at risk and getting to know the community. So I'm really excited to be on the show and appreciate the Chamber and the members for all their support during these last couple of years and into the future.
Well, thank you. Yeah, what a year to start. So 2 years in, you had one full year of kind of getting your feet underneath you, setting forth on your vision and your work around leading CARES, and then COVID happens, and we've all had to adapt and change with COVID. How has the last year been?
Yeah, so it's, first starting with the tornado and then the COVID pandemic was pretty challenging, but, we pivoted very quickly. The great thing is, our board is very engaged. Our board chair is in the medical community. So we're able to hear a lot happening about what was going on with COVID prior and when we shut down. So we really planned well, and we took our staff, working remotely and started to really find creative and innovative ways to serve our clients. And so we started serving them via phone initially. We did drive-through testing for HIV and HCV, and wanted to really make sure that we could provide food and nutrition. So we did a drive-through for our food and nutrition program, started to see people. We would go to their homes and engage with them, social distancing. So really started to find ways to really kind of different ways to engage people. And then very quickly too, started going on these virtual platforms. And as I said, we've become, experienced in these platforms to engage people. But just really, it was critical and important to educate our clients and to get them familiar with using, these virtual platforms to engage. Telehealth was something that we started to really grow. And we also found out very quickly that there was an issue with connectivity and for people with access to use, they had no mobile devices or computers to really be able to engage in connectivity. And so we were able to use some of our CARES Act money to really go ahead and get people access and get them the tools they needed so they could engage with us and to receive services and alleviate barriers and meet their needs.
Access had always kind of been an issue, correct, with the services of CARES. I know location and being able to have patients and have people reach CARES in locations. You just talked about access virtually, but access before the pandemic was an issue I know you guys have been working really hard on.
Yeah, and the great thing is not only do we expect folks to come to the brick and mortar and to the building, but we also outreach. So, Nashville CARES, having been around for over 35 years, we've kind of really learned that it's important to, reach out to our clients and our, community to really provide them the services. And so we take services to the people, and that is something that we've really grown. And now we have a hybrid approach because, this new normal, we're going to continue to provide services to people who benefit, because even when you think about behavioral health and some of the, stigma and the barriers to people accessing behavioral health, now they can do that from the comfort of their home and connect with a therapist virtually. So I think there's really great opportunities using telehealth platforms that we were trying to push, but now we're really finding that there's benefit to alleviate barriers to access. People have to travel. I mean, we cover 17 counties, so there's really issues of even people coming to receive services, whether they're behavioral health, medical services, supportive services. So I think this is a great way for us to be able to engage people and alleviate a lot of the barriers and meet their needs.
We jumped right into the effects of COVID and the work that we've all been doing and changing our work due to COVID. For those, and I miss, having you explain to those that might not know or be familiar with what CARES does, the work that it does. It's an institution in a way, been around for 35 years, serving such an important role in the community around an important topic. But for those that might not have any idea what CARES is about, can you talk a little bit more about that?
Yeah, so CARES is, an organization that provides comprehensive services. We've been in this community very well rooted for over 35 years, serving 17 counties. And so we serve nearly half of the people who are living with HIV in the metropolitan area. The Tennessee Department of Health epidemiological data states that there's 5,300 people in the Nashville metropolitan area that are living with HIV. We serve over half of those folks at Nashville CARES. So people come to us to receive services that are comprehensive. We really focus on what I call the whole person, which is really critical and important, so we can really meet the needs of people living with HIV and those at risk. So we have services from prevention education, where we provide HIV testing, rapid testing, which really in a few minutes you can know your HIV status. And then from there, we're able to link you into care. And so we have our early intervention specialists that really help people get linked into care. We also go out and provide services in treatment centers. We have a corrections program, so people that are leaving, jails and prisons are re-entering into the community. We're able to get their needs met as it relates to if they're living with HIV. And we also do a lot of education about HIV and STIs out in the community. We work with universities, we work with other nonprofits. We go out, and anybody who needs to know information about HIV and STIs, we actually go out there. We've been in schools, we work with youth, with women groups. So we'll go anywhere. Businesses have called us when we've gone in and talked about the impact of HIV on their employees. So we really have a robust prevention education program. And then we have the care and treatment program, where we have folks that come in, we help them get insurance. We administer the insurance assistance program for the state of Tennessee, and that's why we have coverage all over the state of Tennessee. Anybody living with HIV that needs insurance, we're able to get them linked to, connected to insurance and help them navigate the health system, working with their case managers in their jurisdiction, and then being able to pay for their premiums and co-payments for their medications and their medical services. So that's a program that we are able to provide. And that's really a great program because it's really important that people living with HIV have, insurance so they can access healthcare and get the medications that they need. We also do case management. We have a very robust behavioral health program. We're really expanding and growing that. Right now, we see people living with HIV and also high-risk individuals, but we really want to be able to open that to our community, especially to the LGBTQ community, to provide behavioral health. We found during COVID, a lot of folks that gladly have increased their access to behavioral health, but it's really been a difficult year for all of us. And behavioral health is really important and critical. And people living with HIV and all of us really benefit from behavioral health. And that's really something that we're going to be expanding here in the next couple of years. And we think it's really critical and important. And using telehealth for 17 counties, we can really be able to reach more people that need behavioral health services. And then we also have our food supportive services, food and nutrition, transportation, helping people access, transportation that they need to get to their medical appointments, to other appointments they may have, help people with employment. So we really have that kind of comprehensive approach to the supportive services. And we say people come, we help them access medical care. That's our first priority, but then really help them with all of the supportive services and needs that they have. We pay for housing. So people living with HIV, we help them get housing. We pay first month's rent, mortgage, utilities. So that's really a big program that really, during COVID especially, we were really able to prevent people from being evicted and supporting them with meeting some of their needs. A lot of people lost jobs, so we were able to offset and support them to sustain their housing. And we know that people who have sustainable housing helps improve their health outcomes. And so really a very comprehensive approach, and we meet people where they're at. Of course, our services are free. We're funded by the federal and state through the Ryan White program. And so we receive funds through that, and then also receive private dollars that we really put all those resources into serving people living with HIV and those at risk. So a comprehensive, and then very recently, we opened up a clinic during the pandemic in September.
Tell me more about that. Yes.
So the clinic, it's called the My House Clinic. And we really felt that it was important for us to, as I said, we're serving the whole person, to really be able to provide culturally competent and efficient medical care to folks, and alleviate all the stigma and the barriers that people were having. And so it's really a clinic that provides primary care, really focusing on the LGBTQ community, making sure that we can meet people's just, basic primary care needs, but also people living with HIV can come and receive their care at the My House Clinic. We also provide, it's an STD clinic, so we also do STI screening and treatment. So we're able to see folks around STI and also HIV testing. And very soon we'll be including trans health. We think that's very important and critical. And so we're working through that. And really, it's a comprehensive approach to healthcare for the LGBT community and people living with HIV and those at risk. And we also are doing pre-exposure prophylaxis and post-exposure prophylaxis, similar to what Rich just shared. And that's also a service that we provide, and really focusing on the LGBT community, but making sure that we reach out to communities of color, especially the Black community, same gender loving folk. Since HIV, the face of it has changed, and it's disproportionately affecting communities of color. So that is really something that's important, and we've really been working for over 7-8 years, specifically focusing on communities of color through our My House initiative. So we think it's really important that with this clinic, we're able to meet people, and those that are disproportionately affected also can receive services. We don't turn anybody away, so no insurance. If you're living with HIV and you need to see a practitioner, you're welcome to come to the My House Clinic. We also don't charge, so that is not a barrier for us. Resources are not a barrier. We want people to access care in a timely manner. We want people who are out of care for us to outreach. We have navigators that go out and help to find people that may be lost to care and re-engage them into care. So that's really critical. We have a very robust program since we started called Test to Treat. Since we test for HIV, an individual can get access health care same day, see a provider, be able to get their labs drawn because we have an on-site lab at the My House Clinic, they'll be able to leave with medication at hand. And so really making sure that we get people into care very rapidly. And so it's a rapid initiation. We've had really great stories from our drive-through testing. Last week, we had 3 positives, and we were able to get them into the clinic, and the fastest was in 45 minutes. From the time an individual tested positive, they were able to be at a clinic and see a practitioner and left within 2 hours. Everything was done, and they had medication in hand, 7-day supply, and were able to go to the pharmacy and pick up their prescription.
Wow. That's wonderful. When I got involved with PrEP advocacy, and PEP advocacy, it really was because of the time of a friend of mine being exposed to when they were able to get help and treatment, and then just knowing about that drug and knowing about PrEP, wanting to get that word more widely out there. So to hear that time has been shortened and that you're still, finding positive people that didn't know they were positive and then immediately connecting them to treatment and assistance is just wonderful to hear. Questions on several things that you just brought up. I'd love for you to touch on the communities that are affected now. I think there is still a lot of misunderstanding on who HIV affects most. And as you said, for several years now, I think you said 7, there really has been, I know, as being a donor and supporter of CARES, there has been an intense focus on people of color and the high rates there. But I think a lot of people still think that it's a gay man's disease. They still think of the 80s and the 90s and the height of the AIDS epidemic and think it's a disease, something that affects gay men. But the numbers are not showing that. Can you speak more to that?
So I always say HIV can affect anyone. It's not a disease that is specific to a certain population or a certain group. We are seeing, of course, disproportionately affecting communities of color, especially the Black community, but we're also seeing increases in women and especially women of color. The Hispanic population, we're seeing a great increase there specifically. And in general, I think, in the last, I would say 3 to 4 months, we're seeing an increase in women coming in that are testing positive. And that's something that when the epidemic has ebbed and flowed. And so we were focusing on women at a certain point. We started to see the epidemic go down as it relates to women, also younger folks. So people are getting HIV younger and younger. So it's really important that we really, what I say, focus on prevention and education at a younger age appropriate education, sexual health is really critical because we're seeing younger people that are getting infected. And so I really would say that this is not a disease specifically to the gay community. It is, it's a disease that affects everybody. It's really critical that people know their status. 1 in 7 people don't know their HIV status. And so that's really what's going on. And, you talked earlier with Rich and Steve that we're seeing STI rates are going up. And so we're seeing gonorrhea, chlamydia, syphilis, people coming in with co-infections. So it's really important that we start to think about this really comprehensively from a sexual health and not really thinking that it's only one certain community, but there is a focus because of, the disproportionate impact that it's affecting communities of color, and then really looking at the social determinants that really affect certain groups of people to receive care in a timely manner. And that's really where that equity and trying that level field of being able to really focus on those communities, but making sure that we provide the services comprehensively to anybody that needs them. And that's really what Nashville CARES is about. And that's really what we're moving forward into the future, is to say, if you need services, whether it's HIV, pre-exposure, post-exposure prophylaxis, STIs, testing, please come to us because we are seeing everybody, we're supporting everybody, and we want to alleviate barriers, and we want our community to be healthy, and we want to end the HIV epidemic. I think, Joe, for the first time, I've been in HIV for over 2 decades. I am really hopeful and I'm excited that we can really see an end to the HIV epidemic if we come together collectively as a community and work together I think we can really see the end to this. And I think it's exciting times, and there's a lot of opportunities. We can really learn a lot, but I think we need to work together. We need to partner. You talked earlier about partnerships and really working together. I always say there's so much work in this community for all of us, because there's so many people that are not receiving services and are not receiving care. And so I think it's really important that we really focus on that in the next couple of years collectively, so we can end the HIV epidemic.
Collaboration is key with all the work I feel that our community works on, and especially around this. We've all got to collaborate and focus on this. You just said something that I want to touch on. We've got some questions that have come in, and that is specifically, you've mentioned it. Does your clinic provide trans health care? P Flag Franklin asks that. And then
very soon we will be.
We have a LinkedIn user, Liz from Alive Hospice. Thank you for working to include the trans community, more important than ever with our current political attacks. That is very much the case, I can tell you, as we've been focused on advocacy and these discriminatory bills. Trans healthcare, we get more emails and calls about, can you provide inclusive healthcare options for trans individuals? You mentioned that the clinic very soon is going to have it. Can you speak more about that?
So yeah, we're going to be providing, so our goal is, and hopefully in the next month or so, that, and we'll push this out broadly, that we will have a provider at the clinic that will be providing trans health to our community. And so we're really working on making sure that everybody can access those services. And so we will be pushing out. But if you do have any needs right now, let us know and reach out to us. You can reach out to me directly, or you can call the My House Clinic. We'll be glad, and we'll keep you informed. And Joe, definitely, when we're ready to push, and announce that, we will send that to you so you can send it out to the members and to the community and help us get the word out.
We would love to do that. We are looking, after we wrap up this terrible legislative session and hopefully stop these bills from passing, to really focus on transgender education, transgender issues, and connecting the transgender community more broadly to resources, because they are the ones under attack right now, and we need to do everything we can to support them. And that would be a wonderful part. We'd love to do that with you, as well as some other members that are specifically working on trans healthcare.
Yeah,
that is wonderful.
To be part of that conversation and part of that, collaboration. Thank you.
Well, while we're on the subject of advocacy, and if you have questions, if you're joining us live, please put additional questions in the chat and we'll get to those. But while we're talking about advocacy, can you tell us about some of the different things that Nashville CARES has a role in advocating for change in state and federal HIV policy that affects access to care for those living with HIV/AIDS?
So yeah, we've really have a lot of advocacy efforts. We are have the Tennessee AIDS Advocacy Coalition that's here in Tennessee, and it's really important that we all advocate collectively. And so we have different chapters in different cities. We are really kind of re-engaging in that initiative. We've hired some lobbyists that are working with us, so we're really excited about that. That was started in January. And then also have an advocacy coordinator. But then we also wanted to make sure that we elevated the focus of advocacy. And so we have a policy and advocacy committee of the board that is new. It just got started about 8 months ago, but really focusing on advocacy and making sure that, we really look at what's happening around HIV and access to care. And of course, there's the criminalization law out here in Tennessee. We've been really trying for the last 6 years to modernize the law. The law currently states that a person who does not disclose their HIV status will have a felony and be on the sex registry for life. That is completely inhumane. This is something that is not acceptable. People living with HIV are now undetectable, living healthy lives. This is not acceptable, and we have to make a change. And so right now, this is one of the first advocacy bills that we're taking on, and we're very excited that we actually have a House bill and a Senate bill that now has been introduced, and we're going to be working through the end of this session and into the summer and fall and next year I am hopeful that we are going to make some great strides, and hopefully we can change the bill, and we can have a bill that really provides an opportunity for people who are living with HIV to live with dignity and respect, and so I'm excited about that. And I think we have a great team, and we're going to be reaching out to advocates. So please either reach out to us or we'll reach out to you. Let's work together. Let's have a united voice, and let's really reach out, educate our legislators, our policy makers, to really change this law and really be able to be successful here in the next year. So that's something that we're really putting all our efforts in. The other thing is, there's a lot around 340B, which is the program where you can buy discounted HIV drugs as a 340B entity. That is something that we are part of. Those resources go back into the community to serve the HIV community and the LGBT community. So it's really important that we make sure that that program continues, because it is an opportunity for us to serve more people, meet the needs of people. And we know that federal dollars and government dollars don't pay for everything. So that's a really important program, and that we need to continue. So we're really working aggressively on that too.
It's wonderful. We are looking forward to working with you on some positive legislation around that criminalization legislation. So we're ready to partner together and like I said, have some positive legislation. So
yes.
Well, we are running out of time. I mean, this hour, I really do love talking to our members, and the time flies. One thing I want to make sure that we get to is talking about support for Nashville CARES. One of the questions that came in is, what are the volunteer opportunities? And I want you to touch briefly on that, but then I want to start talking about Dining Out for Life, which is the annual program that we do here to go out and eat, and it all goes to support Nashville CARES and ending the HIV/AIDS epidemic. So tell us first about volunteering, how people can volunteer, and then let's talk about Dining Out for Life.
So thank you very much for being interested to volunteer. You can visit our website. We have a very robust volunteer program, and a lot of our volunteers really help clients directly. So it's a great program, and we have a lot of initiatives that you can help in. And actually, one of them is Dining Out for Life. We are looking for host volunteers. And really, this is an amazing program, and I think it's a great partnership between restaurants here in Nashville. We had a very difficult year last year for our restaurants during COVID. And so we're very excited that they are willing to continue to support us. This is our 19th year of Dining Out for Life here in Nashville. And it is a partnership with the restaurants. Part of their proceeds for the day, which will be April the 20th, is the kind of official day. And then a lot of them are going to be doing brunches for Saturday and Sunday. And a lot of the members of the chamber are supporting us, the restaurants. So thank you very much for your ongoing support. But we really do need hosts. So if you want to volunteer right away, please visit the website that's shown here on the screen and come and host. And really, hosts kind of help us either get folks to their favorite restaurant or really help be at the restaurant that day. I know all of us during COVID have a lot of restaurants that we enjoy and like and that we've been ordering. So please go on our website, see if your restaurant's there. If you have a restaurant that you would like to be part of it, you can still give us a call and we can get that restaurant registered. But it's really a great way to be with friends, either dining in or dining out. A lot of folks are going to also just, have takeout and take it home and enjoy it with their loved ones. Or some of them are going to go to the restaurants. All of the restaurants are going to comply with COVID regulations and social distancing. So you can see the capacity of each restaurant on the website here if you go out, and a lot of them will be doing curbside and takeout. So we really appreciate all the support. And thank you to all of the restaurants of the Chamber for really supporting us. Also this year, the food trucks have kind of joined forces with us, which we really appreciate. So there's going to be 2 food trucks at Nashville CARES parking lot on April 20th, and that's on Thompson Lane, and then one in Antioch at our My House facility.
Oh, so that's very cool.
Yeah, so that we're really excited. And then there's going to be a lot scattered out in the community. So check and see if there's any food trucks that you like. There's some really good food trucks that are going to be supporting us on April 20th.
That's wonderful.
And then we have a great special drawing. We have a vacation, which it's 2 years. So you can take it in any time during the next 2 years. and it is a 6-night, 7-day Caribbean vacation for two. So check that on our website, and you can enter to win that trip. And I think with all of us being home and not going anywhere, I think this will be a great opportunity to go out and lay in the sun and enjoy this vacation. But I think overall, I just really want to say thank you and a great appreciation. This is a great opportunity for us to talk about HIV, to be with our loved ones, to bring up the issues that are going on in our community. We have great ambassadors, and we really appreciate it. The restaurants have been phenomenal. So please join us for dining in or dining out this year. And let's support the restaurants, and also let's support Nashville CARES and people living with HIV and those at risk, so we can put these resources back into the community and help folks meet their needs. So with that, I say thank you. And I really appreciate the Chamber and all the members. And I miss you all. Haven't been able to see each other. So thank you.
Miss you too. We used to see each other at so many events that we were both at, and I'm ready to get back to those, let me tell you. I can't wait for Dining Out for Life. The Chamber is supporting all of our members and really making sure our member locations are known who are participating in it. We used to host a specific restaurant, but now we're just sharing the love and making sure everybody knows our members that are participating. But the important thing is, as you said, go out, dine out, and support the restaurants and support Nashville CARES. Thank you so much for joining us today. It was wonderful to get to talk to you and hear more about what's been going on at CARES. Just great to see you.
Great to see you, and thank you all, and thank you for the community. You've been a great support. Have a good day. Thank you so much.
Well, that wraps up April's Member Connect. Don't we have some incredible members, 2 awesome members doing great work, just supporting this community and keeping the community healthy. So many things that both are doing to keep Nashville strong and keep Nashville going. We are nothing without our members. It's always great to talk to them, and we're so appreciative of them and you for being a member. If you're not a member, we'd love to have you join us. We will continue to advocate, educate, and connect the community. That is what we do here at the Chamber every single day. Thank you all for joining us. You can find more information out about the Chamber and the members we profiled here today on our website. Have a great day, and we'll see you very soon.